happening or are happening accidents or injuries inside of the organizations, it doesn't matter what kind of organization we are talking about. Also here at school we have some accidents or some injuries, level injuries around our, how can I say, around our activities. So we have workplace injuries, we have illness and fatalities, cause immeasurable pain and suffering to employees and their families. So it's something about every day. It's a common thing in our environment. It doesn't matter if it's an organization, or we are talking about an organization of services, or if we are talking about an industrial organization. So every day there is a lot of accidents or injuries. Recent estimates indicate that workplace injuries and illness cost our nation, for example, in the USA, because we don't have the data for here to Mexico, around $170 billion per year in a wasteful and often preventable expenses. What we can do, or what can we do about it? Those money that we spend or that we waste about injuries and about accidents and about illness inside of our organizations can be saved, because we can do some, or we can achieve, or we can give some prevention, some preventive actions inside of our organization. So we can save a lot of that money. Effective safe and health management system have proven to be a decisive factor in reducing the extent and severity of work-related injuries and illness. If we in our organization, inside of our organization, have a safety and health management system, it will reduce our cost because of injuries and because of illness, of course, and because of accidents. It will reduce. It's a fact that if we have a system that manages all that kind of things, we can reduce our costs. So a safety health management system will result in a reduction of injuries related cost. The savings, when properly administered, will exceed the cost of workplace safety and health management system. The same thing as happens, for example, with you, when you doesn't have your cell phone in your hand, happen with the enterprises. If an enterprise doesn't have a safety and health management system, it is costful. It is more cost. It costs a lot that if we have it. And the money that we spend to make or to improve or to apply a safety and health management system is very little in comparison with the money that we are spending or that we are wasting if we don't have a system of safety and health inside of our organization. What are the critical elements of an effective system? Well, the critical elements of this effective system are management commitment and employee involvement. If my worker isn't or doesn't have the interest on my health and safety system, it won't function. It won't have it won't cover the expectation that we have on this system. And of course, if my manager, if my director, if my boss doesn't have on mind, then we have to hold a management system, a safety and health management system. It won't reach the objectives that we are waiting our system reaches. Worksite analysis. It is true that sometimes we try to apply some tools in one factory and after going to another factory and apply the same tool. No. When we want to apply a safety and health system management, we need to analyze the workplace because it must be in effect. We must have in effect a handmade, to tell you something, a handmade system to a specific organization. It is true that I can come here with a new jeans and tell Mario, hey, come on, use that jeans, and maybe he will suit that jeans that I have in that moment. But if I try to suit that jeans that uses Mario in another person here inside of the group, it is true that maybe it won't fit in the same way that it fitted with Mario, for example. What I mean is that if you want to apply a system, you need to analyze, you need to know exactly what are your needs inside of your process. Hazard prevention and control, it won't have any function, it won't cover any function. A system that doesn't prevent hazards and that doesn't control hazards inside of my organization. Training employees, supervisors, and managers, of course, if my personnel inside of the organization doesn't know what is safety and doesn't know what is healthy in the organization, my system won't have any valuable function. So the employees, supervisors, managers, directors, all the people inside of the organization must know what is a safety and health management system, and of course have to know what are safety and what are healthy. A management commitment and an employee development. When we talk about our organizations, we need to have inside some people that control or that manage or that take a view inside of our system. So develop communicate a safety and health policy to all employees. For example, you can select somebody inside of your organization, that person or persons will have the purpose to spread the information of your safety and health management system. And demonstrate management commitment by instilling accountability for safety and health, obeying safe rules, and reviewing accident reports. When we apply a system of safety and health, we need to compare the after and the before. Because if we apply that tool inside of our organization and things going on as they were in the past, it doesn't matter, or it don't have any purpose, it don't have any sense that we use resources or that we use sources to apply a system for management or to management the safety and the health. If things will not change, it doesn't have sense that we apply that kind of tools. So we need to compare the before and the after, and the before with our system, with the application of our system. Conduct regular and health meetings involving employees, managers, and supervisors is the same as the last point that we were checking. So we need to spread the information in order to our organization have the knowledge about that politic or that tool that we are trying to apply or that we are managing inside of the organization. Assign responsible person or persons to coordinate safety and health activities. Of course, somebody that takes care about the activities inside of our system of management. Integrate the safety and health into business practices, for example, the purchases, the contracts, the design and the development. Of course, for example, purchases, for example, contracts are not inside of the environment of our organization, but we need to take care about